Hello and welcome to this educational video brought to you by Materna Medical. This educational video will review some key points from the Milli instructions for use, or IFU for short. The IFU comes with each Milli device and contains helpful information about your Milli Vaginal Dilator. This video does not cover everything, so we recommend you read the IFU prior to using Milli. The information presented here is not intended to be a substitute for professional medical advice. Always seek the advice of your healthcare professional with any questions you have regarding your medical concerns. Milli is a patient-controlled expanding vaginal dilator that can be used to help relieve the symptoms of vaginismus, or involuntary tensing of the muscles around the vagina, and related dyspareunia, or painful sex. You may be wondering how a vaginal dilator like Milli can help relieve your symptoms of vaginismus. Well, the use of vaginal dilators provides gradual, self-controlled exposure to vaginal penetration. Over time, this may reduce your fear and anxiety of wanted vaginal penetration. Dilators can also promote stretching of the vaginal tissues and controlled relaxation of the pelvic floor. Some Milli users report that using the vibration feature promotes further muscle relaxation. Depending on the severity of your involuntary muscle tightening, your healthcare provider may also refer you to a specialist, such as a sexual health specialist or a pelvic floor physical therapist. The Milli device is stored and charged in the discrete Milli charging case. Once you receive your device, you should connect the charging cable to the port located on the side of the charging case and then plug it into an outlet. While the device is charging, you will see a faint orange light emitting at the port. Your Milli device will flash an orange CH, indicating that it is charging. Your Milli device has a handle and a wand. At the very top of the handle, you will see two tiny prongs. These prongs line up with the charging contacts in your case. The first button below the charging prongs has a little plus sign, and this is what you'll press to expand the wand by 1 millimeter with each press. The next button has a minus sign, which will retract the size of your wand by 1 millimeter with each press. Below this is a digital tracking display. When the wand is at its smallest size, the display will read 0, and it will increase by 1 with every push of the plus button until you get to the widest diameter, which will read 25. The next button looks like two wavy lines, and this is for the vibration feature. When you press this once, you will feel a low vibration. When you press it again, you will feel a stronger vibration. And when you press it a third time, the vibration will turn off. Using the vibration feature is optional, so don't feel like you must use it during your treatment if you don't find it comfortable. The Milli Vaginal Dilator is FDA cleared as a tool intended for controlled dilation of the vagina. It can be used for dilation for an examination by your doctor, in preparation for a surgical procedure, or to help relieve the symptoms of vaginismus, tightening of vaginal muscles, and related painful sex. Women with active pelvic infections or women who have open wounds in the tissues inside or surrounding the vagina should not use vaginal dilators. Pregnant women should refer to their provider for guidance prior to use. As with any medical device, the instructions for use contain warnings and precautions. You should know that prolonged use of the dilator may cause injury to your vaginal tissue. You should contact your healthcare provider if you notice bleeding or have signs of an infection such as unusual vaginal discharge. Always use the USB and charging adapter provided, and do not attempt to modify the device in any way because that could impact both the warranty and the device function. Please note that Milli is for single patient use only and should only be used in the vagina. We recommend you clean Milli prior to the first use and after each use. The device is not waterproofed, so it should not be submerged in water. Wash the wand, the expanding part, with mild soap and water and wipe down the handle with a damp cloth. Do not wash Milli with harsh products such as alcohol. The device is covered in soft silicone, so only water-based lubricants should be used, as silicone-based lubricants can deteriorate the silicone of the device. The four arms of the device are designed to stretch the pelvic floor muscles, but they could be damaged or break if the wand is twisted or bent. There are operating instructions in the Milli IFU, including a fairly general treatment plan. If your provider recommended a dilation routine designed to meet your specific health needs, please follow that treatment plan. The Milli Vaginal Dilator is usually used for 5 to 20 minutes several times a week. It is recommended that a water-based lubricant be used to make insertion more comfortable. When you first start using your Milli, begin with the smallest setting. The display should read 0, and when you feel comfortable, gently insert the wand into your vagina with the tip pointed slightly towards your tailbone. It may be helpful to lay reclined with your knees apart and pillows supporting your head, back, and legs. If your pelvic muscles are very tight, it may be helpful to insert the wand slowly while using deep, relaxing breathing techniques. You may also want to see if the vibration features help you with insertion. Once at least half of the wand has been inserted, gradually increase the diameter of the wand until resistance or tightness is felt, and then pause. Once the tightness is eased, the diameter may be increased another millimeter. If you experience pain, the diameter can be reduced by pressing the minus button. In general, you should try to work through mild discomfort as the tight muscles are being gently stretched, but to stop if there is pain. As you progress towards greater diameters, you should note that dilation setting so you can track your progress. When you get to a point where you cannot expand the wand any further without experiencing pain, note the setting and then either remove the device in its expanded state or press the minus button and allow the wand to contract before withdrawing it from your vagina. How long you will use your Milli device will depend on your underlying condition. Some Milli users will achieve the ability to return to penetrative sexual activity and will not need to continue dilation therapy, but others may need to routinely use their Milli to help relieve their symptoms of vaginismus and associated pain with vaginal penetration. Please know that dilation therapy is a gradual process, so keep working towards your goal and be patient with your progress. We at Materna Medical wish you all the best and encourage you to visit the Milli website at www.hellomilli.com for additional information.